Hello, and welcome to the CM Learning Network Take a Listen podcast. I'm your host, Keri Boyce, Vice President of Marketing and Communications with Health to Resources. And on behalf of the Commission for Case Manager Certification, thank you for joining us today for a discussion about how social connection is intricately tied to health outcomes. Today, I'm happy to welcome both Mary Beth Kurland, the CEO of the Commission for Case Manager Certification, as well as Dr. Julianne Holt-Lunstad, the lead scientific editor of the recent U.S. Surgeon General report, Our Epidemic of Loneliness and Isolation. Through Mary Beth's experience as the Commission's CEO and her daily interactions with case managers and disability management specialists, she is very aware that social isolation and loneliness pose significant risks to a person's overall health and well-being. Now, without further delay, I will turn it over to Mary Beth.
Thank you, Keri, for that very warm welcome. I'm Mary Beth Kurland, and today we're exploring a topic that truly hits home for all of us: the power of social connection and community when it comes to well-being. In today's fast-paced world, the significance of our interpersonal connection often goes unnoticed. Our relationships and interactions with family, friends, and colleagues play a monumental role in our overall health and well-being. In April 2023, the U.S. Surgeon General declared this disconnection as an epidemic in the 82-page report, Our Epidemic of Loneliness and Isolation. The research shows that being socially connected not only enhances emotional well-being, but also has profound impacts on physical health. Health outcomes are intricately woven with the quality of social connections. You've probably come across the statistic before. Lacking social connection is comparable to smoking up to 15 cigarettes per day. It has been repeated by news outlets, government talks, and even a Netflix series. But where does this comparison originate? Well, it's rooted in a noteworthy study led by today's guest speaker, Julianne Holt-Lunstad, and her dedicated research team. This study set out to explore how the lack of social connection stacks up against other well-known factors that might affect your overall health, like smoking. Today, we welcome Dr. Julianne Holt-Lunstad, who is currently serving as a professor of psychology and neuroscience, while also directing the Social Connection and Health Lab at Brigham Young University. Dr. Holt-Lunstad served as the lead scientific editor for the U.S. Surgeon General's advisory, Our Epidemic of Loneliness and Isolation. She also has an adjunct professorship at Iverson Health Innovation Research Institute, Swinburne University of Technology in Melbourne, Australia. She is also the founding scientific chair for the U.S. Coalition to End Social Isolation and Loneliness and the Foundation for Social Connection. Dr. Holt-Lunstad's research about the impact of social connection on health outcomes has been highly cited, and her research includes data from more than 300,000 participants worldwide. Her research and writing has been featured across the globe on major media networks such as CNN, NPR, the New York Times, Forbes, and BBC News. It is my pleasure to welcome Dr. Holt-Lunstad as our guest speaker today.
Thank you so much for the kind invitation. I am so incredibly grateful and honored to be able to speak to all in the audience and to be able to speak about an issue that, of course, I'm very passionate about and is certainly very timely as well.
Julianne, thank you so much for being here today. So, Mary Beth mentioned that lacking social connection is comparable to smoking up to 15 cigarettes per day, and this came from your research. Would you mind expanding on this?
Yeah, in my research, we were looking at the overall effects of social connection on our health. And at the time, really, there was no recognition of this as being relevant to health. People readily connect this with mental health and emotional well-being, but often don't associate it with physical health. And we had data from 148 studies, and we looked at across a variety of indicators of social connection. And what we found was that that being more socially connected was associated with a 50% increase odds of survival. And so when we found that, we knew it was big, but we also knew that the public would probably not be able to, may still not be able to recognize what that means, because we're constantly hearing what's good for us and what's bad for us, and maybe not recognize just how important that is. So we wanted to put it in context to other factors that we take very seriously for our health. And so we found data on that was available at the time on a variety of risk factors for mortality, including things like smoking, obesity, alcohol consumption, air pollution. There were several others, but that comparison is the one that seems to have stuck. And I need to be very careful because I don't want to in any way claim that this is more important than smoking, but rather we need to take this issue just as seriously as we do these other kinds of risk factors that receive a lot of attention and resources, and that our social connection or lack thereof can be just as impactful. And so we really need to prioritize it accordingly.
Yeah, absolutely. So you also mentioned several signs that would indicate someone being at a greater risk for social isolation and loneliness, like living alone or a language barrier. And these are things that would be kind of obvious, but other indicators, they may not be so obvious and they might be kind of personal. So my question is this. Do you have any recommendations for our case managers as to how they might identify these things, and then what's the best way to begin a conversation to help their clients?
Yeah. So in some cases, the whether or not someone lives alone or not, or their health condition might be something that may be readily apparent. However, they may not recognize, for instance, whether or not they have people that they can rely on for support. For example, someone might live alone but have a very tight network that can be relied on, whereas another individual may even have people in their lives, but let's say you find out the client has two daughters that live locally, but realizes that the client is estranged from one of them and the other one is working two jobs and really has very limited availability and can't be relied upon for various support. And so asking more questions about trying to really listen to what their needs are and what kinds of available support they may have is going to be important, because if you just ask, do you have family living nearby? um, that might give them the wrong impression that they have support in that particular instance, when indeed they may not be able to rely on them. So it might require some of these more probing kinds of questions. Another one that might be a little bit more difficult is that we consistently find that those with financial struggles are at increased risk for isolation and loneliness. And it's something that people often are not necessarily going to readily offer up. and and for some might even be a source of shame. And so they may not want, it may take some questioning in terms of even what their financial circumstances are, because some of the solutions that you may be offering, if it requires that they get to a part of town that they don't have transportation for, or they can't afford the public transportation, or you suggest they get involved in a fitness club, but that requires a membership. These kinds of suggestions may be very ineffective if they're struggling financially. And if they are having to juggle multiple jobs, may not have time to do that. And they may not have time to even connect with their family members. So again, probing for these kinds of risks that may exist is going to be important. Another one that perhaps may not be obvious is something like a sensory impairment. For instance, hearing impairments or untreated hearing impairments can put people at increased risk for isolation and loneliness and health concerns as well. And of course, it makes sense if you're having trouble hearing the conversation, you may be less engaged, you may disengage, or you may stop going out because you are embarrassed because you may not be following along. And then when you do jump in, it might sound inappropriate. So you just stop engaging. And so you could see how these kinds of issues might lead to isolation and loneliness, but may not be readily apparent as someone who might be working with a client with hearing impairment to think about their social needs as well as the other kinds of needs. So those are just a few examples.
Yeah. Thank you for giving us those examples. We normally think of loneliness and isolation as impacting the elderly, but your research actually points to a variety of ages. So I'm curious about what demographic was most surprising to you, and what was the biggest aha moment or significant insight that you and your colleagues had about that?
So first off, I want to say that when we look at prevalence rates of loneliness and other indicators of lacking of social connection, one thing that I think is quite surprising to many is, like you said, we associate it with older adults, but the highest prevalence rates were among young adults, and in particular, often the kind of 18 to 24-ish range, depending on the study. That range is a little bit wider. But young adults or Gen Z, in fact, one study showed that loneliness peaks at age 19. And another study showed that even older adults who are currently assessed and screened and identified as currently lonely, when you ask them to describe a time when they felt the loneliness, it often in their younger years and in their adolescence. And this can be an important transition time for in life and in development. It's often a time when individuals are transitioning from their home of origin to living independently from family. It can often be moving away from their community of origin as well. So disruption in their social network. They need to make new friends. There's some work that suggests that social media may be playing a role in this, not necessarily the entire culprit, but certainly how, because it's a time developmentally when it's expected that your social circles are expanding, that the social comparison that has always existed, but is much more readily apparent on social media, can make that comparison level much more obvious and instantaneous. And thinking about that definition of loneliness as the discrepancy between one's desired level of connection and one's actual level of connection. When you're seeing what appears everyone else having a fabulous social life, that comparison, that discrepancy may seem larger. There's also increasing demands in terms of pressures to be successful and highly engaged in school or work or succeeding in some way that demands on time seem to take away from one's social life. So all of these factors may be potentially contributing to that. But one thing I want to make very clear is that there was no single age group that it was absent. So literally anyone at any age, any demographic can experience loneliness. And so while we see that for some age groups or other kinds of demographic factors, and some groups may face more barriers than others, because we are human and we are social beings, we have social needs. And if those social needs are not being met, that loneliness is really our adaptive signal to, like hunger or thirst, signaling us to make a change. And we need to recognize that it is a normal part of life. It's a normal part of being human. So we should, avoid attaching any kind of stigma around that. But at the same time, if you get stuck in it, if you can't get out of that phase, that's when many of these detrimental kinds of effects can occur. Just trying to recognize that there are these kind of important barriers that some groups may face that are more likely to get stuck.
I love that statement that loneliness is an adaptive signal to making a change and it's a normal part of life. That's an excellent insight. So I have one final question for you as we're wrapping up. What are some key recommendations that you would give healthcare professionals to apply these principles of social connection to their own lives to foster resilience and prevent professional burnout?
Yeah. So first off is recognizing the powerful protective effects of being socially connected and how important it is for our being and our health and even our longevity. And so prioritizing our relationships accordingly. And one of the things that I, on a very just practical level, is thinking about, if we want to have good friends, we need to be a good friend. And so really modeling the kinds of behaviors that we would want in others. And I think far too often we wait for others to initiate a social engagement. We wait for others to invite us to lunch or to a dinner party or whatever it might be. But we can take the first step. One of the things that research consistently is showing is that as we support others, it has a beneficial effect on ourselves as well. And this can be a very positive spiral, because as we reach out to others and serve others and really just care about various people in our lives, it builds those bonds that we crave. And simply, if you want to have good relationships, if you want to have good friends, be a good friend.
Yeah, I think being a good friend is great advice for all of us. Julianne, thank you again. It has been a pleasure. CCMC's Take a Listen podcast series features conversations with national thought leaders about trends in healthcare that affect case managers. Thank you for listening to today's episode, and if you would like to learn more about this topic, we offer an expanded webinar featuring Dr. Holt-Lunstad in our CM Learning Network. You can find this webinar along with many other valuable resources at ccmcertification.org. On behalf of CCMC, thank you for your ongoing support and interest in the Commission.